So, hello everyone. Good evening. Assalamu alaikum. Dear friends, colleagues, ladies and gentlemen. As you know, today is the International Day for Multiple Sclerosis, and we are celebrating this day together with all of you. I'm delighted to welcome you and thank you for joining us in this webinar, How to Cope with Multiple Sclerosis. And will join us virtually our distinguished guest, Mrs. Mona, guest speaker, Mrs. Mona Al-Harbi. This is an interactive webinar, and this webinar is sponsored by Novartis, endorsed by the Emmons, and organized by the MCO. Thanks for all of them for their contribution. As I said, this is an interactive webinar, and we encourage you, we invite you to submit your questions in the Q&A icon you see it at the bottom of the screen, and Mrs. Mona and myself will be more than happy to answer your questions. And without further delay, it's my pleasure and honor to welcome our guest speaker, Mrs. Mona Al-Harbi. She is known in the region as a leading MS advocate and personal growth coach. She works in Abu Dhabi, and she's very active in the social media and the field of supporting MS patients. And it's our great honor to have her with us. So, Mrs. Mona, the floor is yours. We are listening to you.
As Dr. Jihad mentioned, I'm Mona Al-Harbi. I'm a transformational and personal growth coach, and I help in raising awareness with multiple sclerosis. So today our session for the webinar will be about managing MS through life coaching. So let's start with the title of the webinar. How can we manage MS? When your doctor breaks the news to you and tells you that you have MS, what's your next step? What do you need to do? For a short answer, you will need some tools and you will need some guide to guide you how to manage or live life with multiple sclerosis. But from my experience, my own experience in fighting MS, I learned that we need 5 main elements. A simple answer will be these 5 elements: awareness, perspectives, change, action, and acceptance. Let's start exploring each and every element and see how can these elements help us in coping with MS or managing our life with MS. If we start with awareness, what does it mean? Why should the patient be aware of his or her illness? Well, there is a say I think most of you are familiar with, is knowledge is power. Once you know more, that means you can help yourself more. And all the power you gain from knowledge will help you manage multiple sclerosis. So awareness is knowledge, it's information. The more you know about it, the more you can cope with it and manage the challenges that come with multiple sclerosis. Let me talk about a simple example. Most of us as multiple sclerosis patients, we go through many different symptoms. And we hear and read about different kind of symptoms. We hear like, why is this patient taking this treatment and I'm taking a different treatment? Why is she in a wheelchair and I'm on a cane? Why can she go out and I can't handle going out or doing things, and many other examples? It's simply because you need to understand what type of MS do you have. Like, for example, if we wonder about other people's MS, or if we read something from online and it doesn't align with what we know about our MS, it will mess with our mental state and emotional state, and it might get our, it might worsen our MS. But if you understood your MS and how it is different from one patient to another, you can feel more confident and more understanding to your health situation. Your doctor can explain your MS, what level, what position your MS in, and knowing about it will help you manage it. You will be able to know how your body works and how to take care of it. Like, let me tell you an example. Maybe some of you, or maybe one of the MS friends you know, they have a symptom of urgency, like a problem in the bladder. If they know about their situation, how will they manage this problem? They will calculate, in simple explanation, they will calculate their intake of liquids or when they drink water. So when they go to a public place, they will like scan where is the nearest toilet. This is one of the examples how to manage your MS. Same goes with MS people who are on a wheelchair. When you search for places to go, you search for places that have ramps, that have accessibility, easy accessibility, that's easy to use a wheelchair. When you, for example, search for hotels, you check if they have elevators. This is part of managing our MS. Like maybe some of you or most of you know part of my personal story with MS and the struggles and the emotional roller coaster I went through before reaching this level of awareness and peace with my MS. After going through that, later on, I realized that it was because of lack of awareness. When I read something or about someone who lost their vision, I go and lock myself in a room and start weeping and like going into this depression. It's a phase. I'm sure many of the MS people or people with MS, they went through this phase. I realized that with the help of my doctor, my MS is manageable. And in this new medical age, we can manage MS. We just need awareness and the right channels to reach them. Each and every MS person is different from the other. Like maybe the depression with me, it took 1 year. Maybe with you, it will take 6 months or 2 years to get out of the depression. And maybe you will not have or experience depression at all. The anger, the fear, the denial, all the phases you go through, it differs from one patient to another. And it depends on how much aware are you about your MS. Which take us to the next element, which is perspective. Perspective. What is perspective? It's the way we look at things. It's our ideas, our thoughts about a certain topic or someone. After we are aware and after we have all the knowledge about our MS, how do we look at our MS? In simple explanation, this is a simple example. It shows you that MS, it is what it is. It's there. Probably it will stay with you until the end of life. It's a challenging illness. It's something that will be there through your life. So how would you look at these challenges? How do you want to look at them? Are you going to take what you can from it and extract your own motivation from inside? Or you want to just keep and complaining and isolating and making or feeling miserable the rest of your life? So it should involve many people in your life, the people you live with. I myself, I involve my children in it. Sometimes they fight who pushes me on the wheelchair when I get a relapse or I get difficulty in walking. Even the parking, they get excited. We have this parking, they call it VIP parking. I encourage them to change the names, to change the way they look at things. Not only me as an MS person, but most importantly is how do we look at ourselves? Even if you involve your family, or you tell your kids like how to look at things. The most important thing is, how do you look at yourself? Your inner self is a reflection of you from the outside. How you treat yourself from the inside is how people will treat you. How you look at yourself is how people will look at you. So this question is for all my MS friends. How do you look at yourself? And most importantly, what do you tell yourself in here? What do you tell yourself? There is a sentence I always tell my children. Maybe if you see them one day, you can ask them. I tell them over and over, especially when I see them in a desperate position. Whatever you tell your brain believes it. What does that mean? I think there are many studies and books that talk about mindfulness and affirmations and how they affect our body. So, in a meaning, watch what you tell yourself. Watch what you tell the inner you. Like, listen what you say to yourself carefully. Be kind and be gentle to yourself. If you keep telling yourself, I'm getting worse, you'll get worse. If you keep telling yourself, nobody loves me, nobody wants to help me, even if you have people who loves you and are willing to help you, but you won't see it because you're telling yourself that. So perspective is very important. The way you see your MS and the way you think of it, you have to change the angle that you look from. At the beginning of my MS, I saw my MS as a weakness. I was in that depression phase. I was in a very bad, dark place. And maybe some of you are going through it now. We're here to help you overcome that. I saw MS at that phase, I saw it as a weakness. And that's what got me in depression and misery. But seeking the right channels and getting all this knowledge and awareness about my MS through coaching and through my doctors, it helped a lot in changing my perspective of it. So now I see it like a blessing. I see it gave me opportunities I don't think I would had if I didn't have MS. It made me look at the things around me differently. I look at my children differently. It made me filter all the people surrounding me. It made me rearrange all the way I think, the way I look at life. That's how much perspective is important. And that changing perspective will lead you to change, which is our next element. Change is a result of the new perspective you have. It will motivate you. Changing your perspective will motivate you to change. But you should sometimes know that change can be bad or can be good. How can you choose the good change? How can you tell yourself what kind of change do you need? Most of the time, change will need us to leave our comfort zone. This is what I practice in my life. To be honest, when I see my life aspect or anything in life go stable or in a flat line, immediately I wake up and change it. Because a flat line in medical terms, it means you're dead. So when I see my routine going as a flat line, I like it to be up and down and has dramatic change. And so whenever I see myself fall in a stable routine, like getting back to this comfort zone, immediately I change. Change, by the way, could be something simple. It can be by changing your daily habits, by changing your food, by changing the side of the bed that you sleep in. It shouldn't be something complicated or hard to do. So that's what I did. I changed everything surrounding me. But I started with myself. I changed my attitude, the way I deal with my kids, even my house arrangements. I removed all the carpets, anything that will make risky for me to trip or fall down. I changed my circle of friends, the people who had negative impact in my head and ideas. Like sometimes maybe a member of your family can be a negative impact on you, but how can you change a member of your family? You can't, but you can change how you take their words, how you take their behavior or attitude towards you. So, but how will this change happen? How can we do this change? It will need actions. Actions are actually the doing of the change. So actions are the doing. So what do I mean by doing? It's like actually doing the, like your contacts. You want to delete friends, you delete their numbers. That's the doing, that's the action of the change you want. Like if you're on a wheelchair today, try to stand up. That's a different action than what you do every day. Try to exercise, try going for a walk if your health can help you. Read a new book with a new topic, a topic that you didn't read before, like economics or politics or whatever. Like you have to do some change that make your brain look at things differently, even if it's something boring or people see it like boring or lame, or it's how you feel about it. How you imagine yourself being, you should work the change towards that, towards how you see yourself. And push yourself to get this inner motivation. Like, let's say some people, they don't have a supporting family or don't have a supporting partner. How can they motivate themselves? From their inner motivation. You bring out your inner motivation, the want of change. You should want it. You should want this action. You should want the change. So when maybe something simple like meeting new people, unfollowing people, following new people, unfollowing boring people, like what I'm trying to say is change can start simple. You can start simple things until you reach the place or the mental state you want to be. And don't be hesitant and reaching out of your circle, reaching someone professional or reaching someone that can help you mentally. There is always help somewhere. You should look for it. You should want to change. And let's say, as an MS people, we think about relapses. We think about getting worse. We should be realistic and honest. But now, after all this change and all this impact you want to make on yourself, on the people surrounding you, you will reach to a level of inner peace, to a level of acceptance that will make you free in a way that you will not be afraid of relapses. Now, if you were stable for a long time and then you got a relapse, now you are a different person. Now you know how to deal with relapse. You have all the awareness, you know how to change, you know how to take actions. So you will do it all over again. La samahallah, or Allah forbid, it happens, a relapse happens, but now you can deal with it and you're not afraid of it. And this is how you take control of your MS. Not being afraid, doing all you can, and it will give you some kind of free feeling once you reach the acceptance level. I wanted to make this webinar short to have time to answer all your questions and to interact with all the participants. And I would like also to thank Novartis and Shuruq and of course Dr. Jihad for his introduction, and we can start taking questions.
Thank you, Mona, for this wonderful presentation. And I have many comments that appreciate what you are mentioning. They say what inspiring, motivating person you are. How could you live with this? So you are convincing everyone about your strength in your weakness and your weakness in your strength. So everyone is inspiring the advice and the comments you mentioned. So we have many comments and we'll cooperate together to answer these questions. I have some comment before we start. The good thing in our region, or in the Gulf in particular, in the Emirate, that the family bonds are very strong. So you will find family supporting, whether daughter, brother, father, mother, they are supporting the MS patients, which does not exist in all societies, in all cultures, So this is very good point, So we have already 659 attendee, so expect 650 questions. So we'll come to the first question. Directly to personally to you, what major symptoms were you affected with? If you like to answer the questions, fine. If not, then we can skip it and take another question. So the
Okay.
question, what major symptoms were you affected with?
Yeah, my first relapse was losing my ability to walk. And then I had a relapse in my right eye. And then in 2019 was my last relapse, which after I started treatment and after I know I had MS, it was in 2019. I also lost the sensation in my legs and feet.
And then what you did after that?
It was slightly reversed by
Cortisone.
steroids, yeah. And then I went back to my medication, but now I can move and I can walk. But I take care, I take care of myself, and I'm pretty stable. The numbness, of course, it's still there, and I'm sure they understand. The people who go through a relapse, they know that they don't go back 100%. And if you can, doctor, elaborate in that more, so they can understand that, and they shouldn't worry about relapses, even if it's a new lesion.
Yeah, it depends on the relapse. Some patients recover fully after taking steroid, which you have mentioned. But if the relapse is a big relapse, major relapse, there might be a partial residual deficit after, not full recovery. Some weakness may remain there, but it may take longer time to recover. So here it's not only medication, you need rehabilitation, physiotherapy, and I'm sure you did this to make better recovery.
Yes.
So the second question here, as MS patient, will MS shorten my life expectancy? So this is from Fatma Saeed. She's a MS patient. Would you like to make comments on this, and then I can interfere?
I think this is a question for doctors.
Okay, I can tell you now. Luckily, we have high efficacy drugs. We have recent drugs which are very effective. There are some studies done in the past about life expectancy, and the conclusion of it that the lives may be shortened a little bit than normal population. But these are the old studies done 20, 30 years ago, before having highly effective medications. And I think this should be reviewed. And when I say life is shortened, it's only for a group of patients with severe disability, bedridden, having bed sores, infections, fractures. So because of general complications, their lives can be a little bit shortened, but there's not real evidence that the life expectancy is shortened. So the answer, the quality of life may be affected, but not necessarily the life will be shortened. Do you agree on this, Muna?
Yes, I agree totally. And whatever you tell your brain believes it.
Very good. I like this. So the next question, what about having children? Does MS affect fertility? I think this is for you and then for me. You are a mother already of 3 children.
Yeah, luckily I cannot help them a lot because I had my children before I was diagnosed, but the doctor told me if I want to get pregnant again, I just need to adjust my medication That's all. And they didn't tell me anything about not to get pregnant or it's dangerous or fertility, anything like that. But for me, because I didn't decide to have a baby, so I cannot answer that.
Okay. Shortly, MS does not affect fertility. So a woman with MS can have children like any other woman. They can work, they can get children, they can go breastfeeding and so on. The only limitation is medication, what Mrs. Muna mentioned. So certain drugs should not be taken if you are pregnant. So some medication should be stopped earlier, let's say 3 months or 6 months before. However, if the woman wants to get pregnant and her MS is active, we have 2-3 medication can be taken even during pregnancy, like interferons, like Tysabri, like glutamate acetate. These can be taken during pregnancy. Most of our women with MS, they have a normal life, they have big families, many children, and they are working, they are very successful in their lives. The old concept 20, 30 years ago was the message from a doctor to the lady, don't get pregnant. Pregnancy is not good for you. But this have a change over decades. And now even we say pregnancy is good for MS patient. They feel well, they feel no relapses, feel active. The only thing after delivery, some of them, maybe 10% may get relapses. So they need to be treated and they have to resume their medication immediately. So pregnancy, this is a big issue, pregnancy and family planning, which needs maybe another 1 or 2 hours to talk about it. So shortly, MS does not affect fertility. We encourage women to have kids, but certain medication should be stopped before, and some medication can be continued. So you should consult with your physician. The other question is similar. What about having children? It is similar as MS. We answered it already. That's from
Something
Khalid
I
Hassan.
heard in another webinar is that if an MS woman want to have children, there will be more than one doctor following up with her. The OB doctor, the neurologist, and the fetal doctor. I don't know what they call, but I mean pediatrician. All doctors will be following up with her. So I don't think there is any worries if you have those much doctors following up, and medicine is changing every day. So.
Yeah. Thank you, Mrs. Mara. This is a very important point. So it is multidisciplinary team. There are many healthcare providers taking care of the patient with MS if she gets pregnant. Will be the neurologist, the gynecologist, the obstetrician, and then later the pediatric after delivery. And we have large pregnancy registry encouraging ladies with MS to get pregnant. Again, you should get medical advice. Medication is the problem with this. Some medication can be given, some medication should not be given during pregnancy. Another question, peace upon you, doctor. I have a question about Kesimpta, ofatumumab. Is it excellent? Yes, Kesimpta is excellent. It's one of the newer drugs. We are not going to market drugs, but it's manufactured by Novartis. But it is the good thing of this Kesimpta, ofatumumab, it's self-injection. It's highly effective drug. And the good thing, there is flexibility. So you can stop it anytime because it's monthly self-injection. And the good thing, again, I'm not advertising the drug, but because question came like this, it is self-injection which works automatically. It is self-injection, you just put it on your skin and the injection will go and stop automatically. And it's given once monthly. But again, your doctor should decide, do you need Kesimpta or not me on a webinar. The next question from, I could not mention the name. What causes MS? Why is it if you have MS, you might have numbness in your lower legs? So, Mrs. Muna?
Yeah,
Me
for
or
me,
you?
it was, for my case, because most of my lesions were in the spine and the neck area. So that's why my legs and arms were affected. But from
Okay,
a
so-
medical perspective, I think you should answer.
Yeah, okay. So in our nerves, we have sensory receptors which convey sensation from the limbs, through the nerves, from the arm or the leg, through the spinal cord, which Mrs. Mona mentioned, goes to the brain. So there is the pathway. The neuron is very long. It is about 1.5 meters length. It's like a wire, like this wire. So sensation will be transferred during in this wire. If this wire doesn't work, sensation will be interrupted. It doesn't go properly. The message will not go properly to the brain. And same applies. The orders from the brain to the periphery will be interrupted because the nerves are damaged. So that's why you get altered sensation, pain, numbness, tingling. So the sensory dysfunction is related to conduction of impulses because the myelin surrounding the neuron is damaged. We have another question here from Hadi Shahir. Does neuropathic medication help with multiple sclerosis? I'm sure there is a cure. I had 2 relapses till now, from 2013 till now, when I got diagnosed till now. So Hadi is asking, she had neuropathic pain, 2 relapses in 2013. And is there any treatment for neuropathic pain? Shall I?
Yes,
Yeah,
sure.
there is specific medication for neuropathic pain, and neuropathic pain affects more than 40-50% of MS patients during their course of disease, not necessarily to be all the time. It can be a presenting symptom, can be during the course of disease. Treatment is easy. We have some medication called pregabalin or Neurontin or even carbamazepine, merely anti-epileptic drugs, can control the chronic symptoms. These are chronic symptoms. Most of the patients live with it. They are not serious. Patients are worried. They have numbness, tingling pain. They think it's something serious. This is a relapse. It's not a relapse. It's just part of the chronic symptoms. And there is treatment for this, and it can be controlled with medication. The next question, is there multiple sclerosis? Sorry, you are moving the slide. Let me move it. The answer, the question. Is there a multiple sclerosis society or a group discussion where people with MS can share their fears, challenges, and experiences? This is a very important question. And Mrs. Mona will start and I will follow her. MS Society, MS Support Group. You are MS Society, Mrs. Mona, so you are MS Support Group. Okay.
Actually, we have now a website called msbuddies.com. It's by Novartis, actually. And for the UAE, we're working now soon. It will be announced soon for a national MS society, but let's keep it a surprise. 700 people. Let's keep it a surprise.
Yeah, it's no more surprise. It's lovely surprise that there were some MS support groups in the past, but they depend mainly on personal basis. They were good. They have meeting, education, but it was not constant and was not continuous. It depends on person. So when persons left, the activity is stopped. But now, as Mrs. Mona, there is a move, official, institutional, governmental move to establish a high quality, very active NMSS, National MS Society. And hopefully the officials will announce it in the coming few weeks. That will be a great move, great success to support the patient and physicians and the MS Society. Does everyone who develop MS experience the same symptoms? When do most people develop condition? So the question, are all MS patients the same? Mona?
Of course not. Even if we have similar symptoms, each and every MS patient have his own path of treatment and his own path of coping.
You're absolutely right. So why this is happening? Patients are not all the same. First, some patients having mild disease, some patients have moderate disease, some patients have severe MS disease. This number one, severity of the disease. Number two, the stage of the disease when they are diagnosed. Some patients are diagnosed early, some patients are diagnosed a little bit late for many reasons. The third important point that the symptoms will depend on localization of the lesion, localization of the relapse. So the relapse happened in the spinal cord. patient will get symptoms in lower limbs, weakness in lower limbs, or bowel dysfunction, bladder dysfunction. If patient get relapse or attack affecting the optic nerve, they will get impaired vision, optic neuritis. So, and if they get motor problem, motor cortex, there will be weakness in the arms. If they get cerebellar attack, it is a relapse in the part of the brain responsible for balance, they will get imbalance. So symptoms vary, severity vary, and that's why treatment will differ according to the patient's condition. Luckily, we have mild disease-modifying drugs, we have moderate, we have high effective drugs, and we have medication suitable for different patients. So we individually decide the treatment according to the patient's condition. So is there any family history for you, Mrs. Muna? The question is to you. Feel free to answer yes or no. Or you can tell me.
After I got the diagnosis and after I learned about MS and what is MS, and luckily because my sister is also, she's a doctor, so unfortunately I'm the only one. We looked in both sides, my father's side, my mother's side, like uncles, grandmothers. We didn't find anyone that had MS. So I'm the first in the family to develop MS, unfortunately.
And
It's an honor. Maybe it's an honor.
Hopefully the last to get MS. Anyhow, in some families, it can be genetically determined. I mean, if you come to the etiology of multiple sclerosis, we know it can be environmental, infections, and genetics, interaction of three. So genetics may happen in some patients, not necessarily in all, but something very important that if you have MS, not necessarily you will give it to your kids. It's not necessarily inherited in all patients. And something important, if I have MS, my kid may get the gene of MS, but not the disease. So the gene needs further mutation in environmental factors to produce the disease. So in few patients, it can be familial. We failed to identify certain genes in the Emirate. We did many genetic studies on many patients. We could not find any abnormalities. But we have a form called familial form. Sometimes it may spread in families. Why? Because they were exposed to the same environmental factors. So not necessary to be a positive family history. Majority of patients, they don't have family history. And they will not get in the future family history, and they will not give it to the kids. So we don't need to worry about this. Another question here, do plasma exchange help to treat MS or not? Okay,
it's a question for you, doctor.
Yeah, okay. Plasma exchange is one of the last options to treat a relapse. Usually, you see, treatment of multiple sclerosis is three things. First is to treat the relapse. When relapse happens or attack happens, we take steroid usually. And then treatment of disease-modifying drug, preventive treatment to prevent occurrence of disease. And the third is treatment of symptoms like numbness, spasticity, bowel dysfunction, and so on. So we come to plasmapheresis. If the patient fails to respond to steroid, we may think of PLEX, plasmapheresis, after 2-3 weeks. But it's not a standard for all patients. But it's one of the last options if they fail to respond to medical treatment, steroid, or other disease. So the next question, possibly Mrs. Muna, what physiotherapy you are undergone, Mrs. Muna? They are asking you.
Yeah,
I'm not a man.
that's okay. I can answer that. Actually, I did two kinds of physiotherapy. First session was during my relapse, and it was like different and more gentle than the one just for follow-ups and just to stay active and healthy. And actually, I have a very wonderful physiotherapist, and she told me, or I learned from her, that muscles have memory, and how much we train our muscle, they will remember our movement and what we train them. So I tried physiotherapy in the past 5 years a lot, and I can tell them that it helped. Maybe not the big help that they expect, but it has to be for a long term in order to see the result of physiotherapy. You have to keep continuing like 6 months plus, so you can see like how much it can help in movement and adjusting. Like sometimes my physiotherapist just give me sleeping positions, easier sleeping, so the numbness don't bother me all night. So she just give me like sleeping positions. It shouldn't be like something hard or something you don't look forward to go to these sessions. It depends on your case or how severe your symptoms.
Thank you, Mrs. Muna. This is very important. Physiotherapy is extremely important, and it's equally effective like medication. So we encourage MS patients not to be lazy. They will say medication doesn't work. Yeah, medication will work if you work with the medication. So you have to help your body, as Mrs. Muna mentioned, to move. There are different ways of physiotherapy according to the patient's condition. Like patients having weakness, I'm not a physiotherapist, but we know from our patient and our colleagues in the physiotherapy and physiatrists, if there is weakness, we need to strengthen the muscles. If there is imbalance, walking disability or imbalance and steadiness, then your physiotherapist will give you some hints to train you how to keep balance. So there's coordination exercise. There's treatment for spasticity. If the patient having spasticity, there's specific treatment for spasticity. So for weakness, for spasticity, for coordination, for pain, there are different ways and different programs the physiotherapist will instruct you what to do. And what is more important is what Mrs. Muna mentioned, continuity. Don't depend that physiotherapy during the session, half an hour, will give you everything. It is very important what the physiotherapist trains you to go and do it at home. And you have to do it at home, in the garden, in the mall. So keep moving most of the time. Moving, motility is very important. And luckily, we have medication. If the patient's having some difficulty in walking, there is some specific treatment which helps the patient to walk, helps the spasticity to be reduced. So physiotherapy is very important, but we have to help the physiotherapy and help our bodies. It is not only medication. Thinking is very important, and the programming, what sort of rehabilitation is very important. So here we have a question from Lamia. I am a physiotherapist, and I have lots of MS patients. They have problem in dealing with spouses due to cognitive issues with time. They start to have depression due to putting under orders and not being heard from their spouse about their needs of feeling. They are dealing with teams, and they are crazy, and they need to be taken seriously as normal. So the question here after this comment, which I don't take all of it, is there support and education for spouses in UAE? And please mention it so I can guide my patients. This is an important point because some of the patients, not all of them, they get cognitive dysfunction. And Mrs. Muna mentioned depression. I can mention fatigue. In advanced MS advanced cases, they may get mental problems like laughing, crying unnecessarily, but this is advanced cases. And for all these types of cognitive dysfunction, there is a treatment, number one. There is medical treatment, there is psychology, social treatment, and I didn't see any patient who could not be treated successfully with this. Depression is part of the MS. 40 to 60% of MS, they feel anxious, tightness, anxiety, like any chronic disease, like migraine, bronchial asthma, diabetes. So they have to get depression. And we have to search for depression in a MS patient. It can be treated with medication and with support. So all these things can be treated. The question here, is there an education for spouses? I can say there is education for patient number one and for spouses number one. We used to have family meetings, patient family gathering and lectures. We missed it during the COVID. And hopefully with the guide of Muna, we can resume these activities in the future.
Actually, Dr. Jihad, I can share a small experience about this part, especially that in our culture, like, you know, sometimes women after having children, they think they're always forgetful and they don't focus and they lose their concentration. I was literally saying out loud that I feel I'm more stupid than before. I feel like this is what I say. I use these words. I feel like I'm stupid than I was smarter back then. I was smarter when I was younger. I go through this and then after I realized and with awareness, I knew that this kind of problems happen with MS people, especially cognitive abilities. And then I learned, and with the help of nurses and the help of the doctors, that there's things that you can practice that can help this cognitive problem, because you cannot control it. Even if we use this medication, and it still you have to do something, you have to push yourself to overcome it. Like there is a website called Stay Smart. It helps you with this exercise, and more reading you do, if you read a lot and like keep engaging, keep practicing, like scientific things that stimulate the brain.
Thank you. These are great ideas, really, the websites and the support. Hopefully, with launching the National MS Society, there will be some campaigns to educate families. It's extremely important. And again, before the COVID, we used to have some campaigns. All the family will come in one of the hotels. You have lectures, gathering, and education about rehabilitation, bladder, sexual dysfunction, cognition. So the family during this education are very positive. Basically, in my clinic, very busy MS clinic, usually the spouse will come together, like the wife and the husband, if she's a MS patient, or if he's MS, his wife will come with him. And I feel they are greatly over caring. They take care of details and they support each other. But maybe some examples are there where more support is required. So this needs actually professional institution and society support. So I echo what Mrs. Muna mentioned about this support requirement. One question here, did you experience any difficulty of breathing? If you are you undergoing chest physio or pulmonary rehabilitation? Do you have breathing difficulty or?
Yeah, no, I didn't do any rehabilitation about that, but I used to have, these, I don't know what they call it, like on my rib cage, like some kind of pressure, this kind of, but they told me it comes and goes with people with MS and in general with the nervous system. So it's not specifically, they told me it's not specifically from my MS. And this is one of the misleading things that happen with people with MS. Anything happened to their body, sometimes they think everything happened to their body is because of MS, like headaches, like something, like when you go to the doctor and he tells you it's not from the MS, you understand more what to look for and to differentiate but what is fatigue and what is MS and what is a normal, like something else, you can add to that, doctor.
Yeah, I think this can indicate anxiety rather than organic.
Yeah.
It is breathing difficulty is not part of the MS unless there is severe paralysis of the muscles of the upper limbs and chest, which is unusual except in advanced cases. But I would say the difficulty in breathing is not a standard or a typical presentation or symptom of multiple sclerosis. It may happen due to anxiety. We have many patients, when they are severely anxious, they start getting panicky attack, chest pain, but they are not organic. And we reassure them, but we may need to do some investigations. Again, except in advanced cases, some patients, they are bedridden, so they may get difficulty in breathing, aspiration, pneumonia, but it's extremely rare, extremely unusual. So the next question from Lakshmi, the second question, professors, I would like to know the role of vitamin D in the management of MS, and if it is routinely prescribed, does it have any impact on reduction of relapses? Do you want to make a comment or me?
You go ahead, doctor.
Okay, thank you. So first of all, there were large studies on a huge number of patients globally. The largest one was in Australia a few years ago, and they discovered that vitamin D deficiency was associated with disease activity. So it does not cause multiple sclerosis, does not lead to relapses, but it may lead to disease activity. Now, something important in the Gulf, the sun is very hot. Vitamin D is there all the time, but because it's very hot, we are not exposed to the sun. Contrary to the West, when they see a little sun, they are immediately going for swimming, because sun is rare there, it's unusual. But here, because of our culture and habits, and when we test vitamin D on majority of our MS patients, it was very low. So it is empirically, we give vitamin D standard dosing 50,000 units weekly. And scientifically speaking, this proved to reduce or help to reduce the disease activity. Okay, so we don't give it to treat MS, so it is not sufficient alone, but it may help to reduce disease activity. Vitamin D metabolism in the body is under immune system, under immune control. So hopefully we give vitamin D empirically, 50,000 units weekly. Of course, we have to take, in addition, healthy diet. This is very important. And when I say healthy diet, I don't say McDonald's or hamburger. It is fish, salads, fruits, grills, seafood is very good. So this is the healthy diet, balanced healthy diet. And they say the Mediterranean diet is the best for MS patients. And it supplies you with all the required vitamins and with vitamin D in particular. We go to the next question. Are there any ongoing trials in MS management in UAE? He is a clinical pharmacologist. Yeah, we have many drug trials in Dubai and Abu Dhabi in the major institutes, either related to registries or drug trials, phase 3 or phase 4. I cannot tell details about it. There are ongoing trials. We are about to close it, and we are planning to have further trials. So there are trials basically on drug trials on treatment of MS. Let me go to the next. Sorry. What exercise or home therapies help you most to manage your symptoms, Mona?
Yeah, after I leave my physiotherapist, I do some exercise أو تمارين بدون ما أتحرك مسافة بعيدة. يعني يكون mobilized, like in one place. I use the band. There's like this band they gave me. I can use the band and like some rolling on the wall with a ball in my back. Simple things. And outdoors, I just do the walking. I don't try to overheat my body.
Okay, that's great. Basically, you recommend you have to keep moving. Any exercise not harmful to you is good for you, for any patient. But again, exercise should be programmed according to your stage of disease and the disability, the deficit you have. So if you have walking problems, we encourage you to walk more. If you have imbalance, coordination problem, there's certain exercise helps you to keep balance, like walking on the sand beside the coach, beside the sea, or walking online. There are some training exercises which can help you, but should be programmed according to your physiotherapist, and they differ from case to case. The next question is, by the way, yoga can help because you said you do exercise sometimes while sitting. So some patients, they do yoga exercise, which is very helpful actually.
But I think, again, doctor, we need to mention here, because of fatigue, most of the MS people, they think that exercise will worsen their fatigue. Well, actually, I tried that and I used to think the same thing, but actually exercise made the fatigue less and gave relief to my body. And by experience, it's the opposite of what we think. Exercise doesn't increase the fatigue. It actually gives some relief to the body.
Yeah, very good point. You have to keep exercising. Those exercise according to your stage. So a question from Aisha Rashid. After diagnosis of MS, the doctor said that oligocoronal bands after examining CSF is negative. He told me this is good. What does this mean? So number one, multiple sclerosis is clinical diagnosis supported by MRI, history, examination, MRI, and sometimes we need the CSF. Recently, we don't need lumbar puncture and CSF for all patients, but in the first episode, we have to do CSF. If it is positive, this will support MS. If it is negative, it does not support MS. So I'm not sure about Aisha Rashid, if CSF is positive or negative. We expect in MS patient to be positive. 95% of patients with MS, they have positive oligocoronal bands, and 5% they have negative oligocoronal bands. So your doctor may be right, I'm not sure. We have to take all the clinical picture. So I recommended personal communication to know the MRI, the presentation, CSF before judging. I cannot say you are MS if CSF is negative, is good or bad. CSF is diagnostic, not prognostic. It helps to diagnose, does not help me to detect the prognosis. Hopefully I answered the question partially. The next question from Liliana Genticchio. Does intensive physiotherapy cause MS episode or exacerbation? Mona answered this question already. Exercise relapses does not cause MS, but you should not go, for example, going to the Himalaya, jumping to the Everest mountain with MS. It should be according to your modest. Don't go the marathon if you have MS. It's enough to walk or run for 1 or 2 kilometers. Dose rehabilitation, severe exercise may trigger a relapse. It does not cause MS, but it may trigger relapse. That's why, for example, patients going to the military training, we recommend them not to go for military training because severe exercise may provoke relapse. So exercise should be properly dosed according to the patient's stage. So severe exercise may provoke relapse. You agree, Mona, on this?
Definitely, yes.
Thank
But
you.
still, they can run MS marathons only.
Yeah, especially for MS patients, like 5 kilometers, 1-2 kilometers, they can do this. In fact, they do this in the West. They have certain limited marathons for some people with certain disease to encourage them to run with certain limit. And if they feel tired, then they will be stopped in the way. So it is stages, So question here, how was the healthcare system supportive in UAE regarding the early diagnosis and detection, management, treatment, etc. So so the healthcare system in United Arab Emirates, from Al Hanouf Al Hamadi. I don't know, she's from Emirate or not.
Yeah.
But maybe you can start your part, I'll tell my part.
Okay. Well, actually, I was lucky because I had many options here in Abu Dhabi. We have many hospitals that treat MS and diagnose MS. So I had luck in jumping from doctor to doctor until I accepted my reality that I am diagnosed with MS. And I see myself very lucky being diagnosed with MS without the spinal fluid test, that's
Okay.
hard. That I think you as a doctor can elaborate more, but I mean as let's say as a process and going through diagnosis, it can fully happen in the UAE. No need to go outside the UAE. I was diagnosed here and all my medication were available and the treatment, and I found all the support from the neurologist in the country.
I agree entirely. So thank you, Mona, for this. Actually, the healthcare system in the Emirates is very advanced and it's updated with many things. We have expertise neurologists, we have MS specialists in all the Emirates. We have major centers treating MS with the state of art in diagnosis and treatment. We have all the medications available, and I can tell you many of the medication before being marketed in Europe after approval, FDA or EMEA were available in the Emirates. And patients used to come and take it from the Emirates. So we have all the medication, we have all the diagnostic tools, and we have the expertise. This is one way. The other way for local patient, everything is supported free of charge, from treatment to medication to rehabilitation to inpatient, everything. For non-locals, we have very good supportive program by the pharma. And Novartis is one of them, the major pharma. They support with Gilenya, with Mayzent, with Kesimpta, with blood testing, with many things. And not only this, many other pharma, they are support with charity supporting financially to get all the medication. Almost all medication are supported for those who cannot afford it. So I appreciate the healthcare system. So I'm very happy with it. And the access is very fast. Once a patient comes to us, with no time can be diagnosed and can be treated, and medication can be available. For the sake of time, because we have 761 attendee, and we are already 9 o'clock, so maybe you can take just a few questions. Unless the organizers will stop me now, and Muna will stop me now, then I'll stop. So we take 5 minutes more.
We can proceed, Doctor.
Yes,
Okay.
we can. It's very nice.
Okay, thank you, Shuruq. Thank you, Shada. So question, does the climate have an impact on MS? Cold weather aggravate the symptoms? I will tell small part scientifically, and maybe Bruno can go ahead. Epidemiologically speaking, the MS is more common in cold countries. When you approach the equator, خط الاستواء, the MS prevalence and incidence will reduce. The classical teaching in the past, don't look for MS in Africa. Don't look on MS in the equator. This was the classical teaching 20, 30 years ago. This turn proved to be wrong. We have MS globally, everywhere in Africa, in Europe, in the Gulf. And I can tell you one of the studies we did in the Emirates, when we came with the conclusion, the prevalence of MS in Dubai was 55 per 100,000, and in Abu Dhabi was around 60 per 100,000. This was a landmark in epidemiology. Nobody believed that the prevalence of MS in the Emirates is high like this. They used to think it is 5%, 2%, 3%. Similar studies were done in Qatar, in Kuwait, in Saudi Arabia. In Kuwait, even it's 85 per 100,000. Saudi Arabia, 65 per 100,000. So epidemiology says that the prevalence and incidence of MS in the Gulf is similar to other countries and maybe a little bit higher. The highest prevalence of MS is in Scotland, Scandinavian countries. It is cold countries. It reaches 100 per 100,000. This number one in epidemiological studies. Number two, we advise MS patients not to be exposed, not to walk under the sun when temperature is very hot, like in August, September, temperature will be 40, 50. Usually MS patient will be exhausted. And we have scientific explanation for this. The neuron, as I said, is like a wire, like this wire. And conduction velocity of electricity in this wire will be higher if the temperature is higher. Velocity will be high. If it is cooler, velocity will be less. So if you walk under temperature of 50, your nerves will be very fast conduction. So they will be exhausted. So most of the MS patients, if they are exposed to hot weather, they will feel tired, exhausted. So our general recommendation, don't expose yourself to sun, hot weather, bad environment, because this may aggravate your symptoms and even may lead to relapse. I have many patients when they go swimming in August on the beach, next day they will get a relapse because high temperature may provoke relapse. Maybe you have comments, Muna, on this?
Actually, that's how I got my relapse in my eyes. I was at the beach with my children. At that time, I wasn't on any medication. I was still in the denial mode of MS, and I didn't fully know what to avoid and what to not avoid. So it happened. I got a new lesion, and it affected my eyes. But I want to add also, there are many things online to help MS and to help to adjust like there is this ice vest they can wear, like, you know, these things. I think if they follow me on Instagram, every now and then I post some, not advertising, but I post whatever helps me, I share with my MS friends.
Yeah, that's very good. Actually, we have to utilize the advanced technology in controlling temperature. We cannot make large AC covering the gulf, but in your area, I know many patients, they got, for example, small tents, which is very cool. If the weather is very hot, they want to sit in the garden, and they don't suffer from this. We recommend for many patients to have their car windows tinted 100% to prevent sun from exposure to sun, and it helps actually. We help patients in their car parking, not to be very far from for working areas, so they can park the cars near to the job to avoid walking for long. So there are many ways to avoid this one. But if you want to expose yourself to sun is helpful. Vitamin D comes from ultraviolet rays coming from the sun, should be early morning or late in the evening. So there is no harm exposing yourself to sun early morning, late in the evening, but not when the weather is very high. How do you manage fatigue, Mrs. Muna?
Thank you for that question. I forgot to mention that. When you want to shut down, shut down. Don't be afraid to shut down and put yourself away from your children, from your family, from important things that matter. It's good to pay attention when your body is calling you for help. Give it time. أعطي وقته. ريح نفسك، اهتم في نفسك، وحب نفسك. ما في مانع انك انت تغيب عن العالم كله يوم واحد عشان تخفف من الألم أو الفتيق أو التعب اللي تواجهه. نسيت أذكر هالنقطة، إن ما فيها شيء إذا اعتزلنا. Life will go on. Life will continue. Just take a break, a full day, a full weekend. Take care of yourself. Give yourself the full attention. Give your body a full rest. And then you can, like, you have all the time in the world to continue whatever you were doing.
Yeah, absolutely right. What we recommend in addition to this, fragment your work. If you have something to do in 6 hours, don't do all of it on a run. So you can do 1 hour, relax 10 minutes, 1 hour, relax 10 minutes, and so on. Number one. Number two, drink plenty of fluids during your work atmosphere. We support our patients in getting light duties. Instead of working 8 hours per day, you work 4 hours, 6 hours, 5 hours, and most of the authorities, they agree on this, because MS is one of the labeled disease to be supported by their jobs, to avoid retirement, leaving the job, so we can support this. This is one thing. This is non-pharmacological treatment for fatigue. We have good drugs which help the fatigue. Two drugs, Mavrigenil is one, and the other one is amantadine. They help actually majority of the patients with fatigue. We have to realize fatigue can be a symptom of depression. And quite often patient will say, I'm tired, I'm تعبان, مرهق. It tends to be, it is only depression. And when we treat the depression, the fatigue will disappear. So it is very important to take proper history and evaluate what does the patient mean with fatigue. There is a question here, أنا آسف دكتور، بس هل ممكن الإجابة عن دواء كسمتا بالعربي؟ أوكي، نحكي عن كسمتا بالعربي كلمتين. كسمتا هو دواء حديث اسمه كسمتا أو أوفاتو توماب. المصنع هي نوفارتس من الأدوية الحديثة. بيشتغل على طريقة اسمها بي سيل ثيرابي ديبليشن. من الخلايا المسؤولة عن الالتهاب هي البي سيل والتي سيلز. فهذا الدواء بيخفف عدد البي سيلز في الجهاز العصبي. هذا أول شيء. ثاني شيء، الشيء الممتاز في الدواء هذا إنه عبارة عن حقنة المريض بيحقنها في البيت، ما لازم يجي المستشفى والانفيوجن سنتر، في البيت بيحقن إبرة، والإبرة معمولة بطريقة تكنولوجية متقدمة جدا، بتعتمد على سنسوري ديفايس، ما محتاج المريض يحقن حتى، مجرد بيشيل الغطاء بحطها على الجلد، الإبرة بتشتغل لوحدها. ودواء ما في منه مشاكل، والجيد في الموضوع إنه فعاليته عالية، إنه ممكن توقيفه في أي وقت استدعى الأمر، إذا امرأة بدها تحمل بتوقف دواء قبل شهرين ثلاثة، إذا صار في أي مشاكل ممكن نوقفه قبل شهر بيطلع من الجسم. فمن الأدوية الحديثة الواعدة بلشنا نستعملها، مسجل في الإمارات ومسجل في مستشفانا. For the sake of time we will take only, we're already 10 minutes late, but I'm happy. Does nutrition have a role in treatment of MS? نورة محمود الشهراوي. Mrs. Muna? Nutrition, we mentioned.
أنت ذكرت دكتور إنه ما في دراسات واضحة بهالخصوص، بس ما يمنع إن الواحد يعني يهتم في أكله في صحته، يمشي على نظام معين، ما يمنع. أنا صراحة يعني وايد أنتبه على هالشيء.
أنا زي ما ذكرت ينصح فيه التالي بالإضافة للكلام اللي تفضلت فيه منى: جريلز، مشاوي، سلطات، فواكه أكثر من أسماك والغذاء البحري، السي فود، ابتعد عن الدهون، عن الأكل غير الصحي، فيتامين دي تاخذه بانتظام، ابتعد عن التدخين والمدخنين. هذه نقطة مهمة لأنه التدخين ثبت علمياً أنه ضار بالتصلب اللويحي ويؤدي لحدوث هجمات. Smoking is harmful for MS patients and its studies have proven that smoking may lead to relapses or activate the disease. So should avoid smokers and smoking. What is your husband's reaction? What is your daughter's reaction? Two questions. Can my daughter? Sorry, one question.
Actually, they can follow me on Instagram. في full video من البودكاست. My son's reaction, my sister's reaction, my husband's reaction is a typical Arabic husband. First in denial. يا بنت الحلال ما فيك إلا العافية وأنتي أمورك طيبة. Because it doesn't show, you know. So كل هالأشياء موجودة في الانستغرام بيحصلونها عشان نكسب الوقت باقي الأسئلة.
أوكي. ماشي. في سؤال what was your husband's reaction, daughter? Okay. If a patient goes pregnant while she's taking one of the contraindicated medication, what are the risks for the baby for the pregnancy? Pregnancy. So number one, abortion is illegal in the Emirate. You cannot induce abortion. If you have taken a drug which is contraindicated as per label, we have a large registry, pregnancy registry. Most of the drugs, the pharma are obliged to write contraindicated, but many of the patients, they got unplanned pregnancy while on medication, and they continue and they have normal babies. So don't worry if you are pregnant and you got some drug which is contraindicated. So most of the drugs are okay, can be managed. We cannot, don't terminate your pregnancy. What we recommend regular follow-up your health by the obstetrician ultrasound. If anything discovered, there is teratogenicity, something abnormal. If you are taking very bad drug, then we can react to this. I can tell you, I have many patients who are taking contraindicated drugs and they delivered normal babies with the severely contraindicated drugs. So not all what is written in papers is applicable in life, but the pharma is obliged to write this, and the patient has to know that this drug is contraindicated. But subhanallah, it may happen, الحمل ممكن يحصل without planning. So it does not mean you have to terminate pregnancy. So early monitoring, early care, ultrasound, gynecology, obstetrician, neurology, and things will be all right. I didn't experience any patient who get teratogenicity due to MS therapy. Low-level vitamin D may cause MS. The answer is no. It may lead to activation of MS, but does not cause. It may lead to a relapse. The first days of my diagnosis of MS, my life changed a lot. This is a husband. At first was sad, but after overcoming the trauma, I decided to move forward and maintain my health and take care of those. I love myself more. Arabic, please. So, Mrs. Muna, so it seems he is a male. I was diagnosed with MS. My life changed. Sorry, my life, not my wife. Okay, my life. And then later I went ahead after recovering the trauma. I think you are the best person to answer him.
مثل ما قلنا دكتور، مرض التصلب المتعدد يعني مرض يحتاج، هو مش مرض ليثل، يعني مش مرض مميت، مرض يحتاج لايف ستايل مختلف، يحتاج طريقة تعاملك معاه مختلف، يحتاج تغير بعض أشياء من روتين حياتك عشان تخليك تتعايش مع المرض. ولكن هو مرض ما يخوف، وتقدر تتعايش معاه إذا قدرت تتابع دائما تعليمات الدكتور من ناحية العلاج الطبيعي، من ناحية العناية النفسية، الصحة الذهنية. هالأشياء مهمة وتساعد مع التصلب. هو مو بكله فيزيكال، مو بكله يعني أعراض، ممكن بالكلام، بالجلسات النفسية، بالجلسات العلاجية ممكن إنها تساعد. ونفس ما ذكرت إن البرسبكتيف غير نظرتك عن المرض. يعني أنا وصلت مرحلة إني أشوفه صديقي ورفيقي، يعني يرافقني في يومياتي، ما أشوفه عدوي أو شيء يعطيني ضعف أو ويكنس. ممكن أنت تضيف دكتور إذا.
صحيح، زي ما ذكرتي، زي ما تفضلتي مسز منى. اولا تصلب اللويحي بدك بالعربي، لانه هو مش مرض مميت ولا سرطان، هو مرض مزمن، لكنه مرض جدي بيحتاج رعايه مستمره طول العمر. والحمد لله بالرعايه الطبيه بالادويه وبالتحاليل وبالفحوصات اغلب مرضى الام اس حياتهم طبيعيه جدا. وفي مرضى كثير بالادويه شديده الفعاليه نسيوا ان عندهم ام اس، حتى نسيوا المستشفيات. يعني بيجوا بيسلموا دكتور، بس انا بدي اسلم عليك ام فاين everything is fine. قدر المستطاع تكون حياتك طبيعيه من خلال مرضك، يعني ما تتحدى مرضك وتجابر وتكابر زياده عن اللزوم. احترم جسمك من خلال مرضك، وقدر انه المرض محتاج رعايه ومحتاج علاج. وهذا مش خوف، هذا عباره عن تقدير واحترام للمرض واحترام لجسدك. احنا بنقول انه العمر بينتهي والشغل ما بينتهي، العمر بينتهي والمجهودات والنشاطات ما بتنتهي. فالام اس مرض ليس خطيرا، ليس مميتا، ليس سرطانا، له علاجات فعاله، واغلب المرضى بيعيشوا حياه عاديه. وعندنا مثل قوي، مسز منى عندها ام اس وعايشه حياتها طبيعيه احسن مني ومن اي انسان ثاني، فهي قدوه بالنسبه لكم.
شكرا دكتور، احرجني.
لا ابدا، that is fact. يعني هلا the last question before the last. How can my daughter make the white cells become more because she's taking a drug which make the white cells low? Number one, we have many medication which is causing lymphocyte very low, the white cells, because lymphocytes are the cells responsible for invading the central nervous system. They are the cause for multiple sclerosis. So we have to reduce the lymphocytes. You don't need to worry about the number of lymphocytes. We have guidelines. Like if some patient is taking Gilenya, lymphocyte will drop up to 300, 400, 500. I don't worry about it. It indicates for me that the drug is working. So I don't want the lymphocyte to be rising. I just monitor it. But if it comes very low, like below 200, I stop the drug. Okay, but I don't raise the lymphocyte. If you stop the drug, the lymphocyte or the white cells will rise. And many other medications work on the same principle. So don't worry about the white blood cells. This is the way the medication will work. Let it be low. This is will reduce the immunity and control the symptoms and disease of your patient. If it comes very low, then we have to stop the drug. Is MS hereditary? We mentioned this before. It's in few patients can be hereditary. The gene can be inherited, but not the MS. We have to differentiate. We have to understand the point. I may inherit the gene from my father, but I will not inherit the disease unless the gene will be mutated and I will be exposed to certain environmental factor. The gene will be quiet, but it can be triggered if some factors will intervene. I hear there is a cure in Mexico. Chemotherapy kill all immunity cells. Don't believe this. There is no cure in Mexico or in Korea. There are many trials. Hopefully there will be cure in the future. I'm very optimistic. متفائل جدا. في many trials everywhere in the world. And we have some drugs which work 80, 90%. So we are near to cure. We are near to normal, right? So let's hope that we are near to normal life with MS treatment. Can MS be reversed? Yeah, it can be reversed with the treatment. Last question. My friend's son admitted in Sharjah complaining of blindness, vision, difficulty of passing urine. Doctor, struggle diagnosis, is it MS or NMO? Please give advice. This is a big topic. We cannot answer it here. NMO is cousin of MS. Needs plenty of investigations. And but one thing, MS they don't go blind. تصلب الوحي لا يسبب العمى. ممكن يعمل لخبطة في النظر، ضعف في النظر، بس لا يسبب العمى. بينما ال NMO نيورماليتي اوبتيكا إذا لم يعالج قد يكون ممكن يعمل عمى. NMO may lead to blindness but not multiple sclerosis. Can MS be reversed? Yeah, it can be reversed. Most of our patients are having normal life and it is reversed. Can MS cause blindness? No, it doesn't. It may cause impaired vision, which can be recovered, but not blindness. Is it effective to take multivitamins? We can take vitamin D in particular, which we mentioned, but multivitamins in general, if you take a healthy diet, you don't need it. It does not help MS. Any stem cell treatment? Stem cell therapy is still under trials. It is promising. Till now, it's not approved, neither by FDA or EMEA. There are many trials, and one of them will be conducted soon in Abu Dhabi, stem cell therapy. It is a trial, a study, but it's promising. But the experts in Canada and America are working hardly, and they reach almost a terminal stage or a final stage, likely within 1 or 2 years will be approved. The last question, nevertheless, I promise it will be the last. From Rana Al-Aqad, what are the symptoms that might alert us this MS patient is going to have an attack? Mrs. Muna?
As my doctor told me, give a 24-hour window. If you experience some symptom, just wait 24 hours. If the symptom is still there, then you have to go for an MRI.
Correct. So you consult your doctor and see MRI. We have to differentiate between minor symptoms like little tingling, numbness, sensory symptoms. They are chronic symptoms. They are not relapse. Relapse will take you to the hospital. But it is good to be aware relapse will cause weakness, impaired vision, difficulty in walking, sphincter problems. So in this situation, you have to consult your neurologist. And in our hospital, we have hotline coordinators patient can contact the neurologist anytime during 24 hours, either the call center or the coordinators, nurses in our hospital. I think we are already 30 minutes, 25 minutes late. There are hundreds of questions, 700 attendees, and people like you, Muna, they like to keep discussing with you. So
I think, Doctor, we should close with this last question.
Okay.
Muna, do you think people should talk about having MS or keeping it private? I think you know my answer since all of you are here and I'm speaking publicly about it. But each and every one of you, they have their own story. And each and every one of كل واحد عنده قصة. كل واحد عنده قصته وطريقة تعامله ونظرته في هالأمور. الشيء الوحيد اللي أحب أأكد عليه إنه لا تخاف. لا تخاف تخلي هالشيء يبين إنك ضعيف أو يبين إنك كلمة أنا كنت دائما أقولها وأول ناس قلت لهم إياها اللي هو دوامي. أنا ما أقول لك إن فيني تصلب عشان تشفق علي ولا عشان تصعب الأمور علي. أنا أقول لك هالشيء عشان تتفهم وعشان تعرف ليش أنا اليوم ما بكون موجودة أو ليش أنا باكر بحتاج باركن قريب أو ليش كذا وكذا. Telling people you have MS لازم تكون أنت واصل مرحلة من الفريندشيب مع الMS إنه عشان تكون. If you're not feeling comfortable, if you don't feel safe talking about it with anyone, just don't. When the time is right, you will know and you will open up about it.
Thank you. I like this final statement. You have to be strong enough to fight the MS, support the MS, and defend the MS. It is disease from Allah subhanahu wa ta'ala. And it's not a shameful disease. It is just a disease like any other chronic disease, like diabetes, like migraine, like bronchial asthma. It can be treated successfully. And luckily, all the officials all over the world, and specifically in the Emirates, are supporting this move. And hopefully in the near future, we'll have stronger support, especially with people like Mrs. Muna and with societies. And with this, I would like to thank Mrs. Muna, number one, with this very strong, important motivation and strong MS advocate and leader. And I would like to thank all the audience for their interactive questions. I wish to have more and more time. And of course, I want to thank Novartis, Shuruq in particular, for this support, and MCO for the IT support. And with this, I wish all of you good night.
Good night. Thank you, Doctor, and thank you all for your kind words. I really appreciate each and every one of you. Thank you so much.
Thank you all. Good night. Bye-bye. مع السلامة. أمان الله.
Thank you, Mona. Thank you, Dr. Jihad. And Zaki, we have Dr. Suhail as well with us.
شكرا سهيل على الخط، ما كنت عارف.
We have and
دكتور
thank
سهيل
you.
رئيس الجمعية. بروفيسور سهيل، مرحبتين. عم تسمعنا من زمان وساكت؟
Yes. Assalamu alaikum, Muna. Assalamu
عليكم
alaikum,
السلام
Dr.
ورحمة الله
Jihad.
وبركاته.
Thanks for sharing your knowledge. So proud to have Muna between us, and thanks for Jihad to leading this. Hope the audience and the patients and the family got a good insight about MS and its how to fight this disease. Thanks again and have a great night. Assalamu alaikum. Thank you, Shuruq.
السلام.
Thank
Thank
you.
you.
Thank
Professor
you. Thank you,
Suhail
everyone.
is the president of the Emirate Neurology Society.
Thank you, everyone. Thanks,
And
Doctor.
he's
Thanks for
always
your
great
time.
support.
And as you said, it's a celebration for all of us. For in the
International
World
MS Day.
Neuroscience
Yeah,
Day.
yeah, great to have them with us.
Yes.
Okay, مع السلامة.
مع
تصبحوا على خير.
السلامة.
Good night,
تصبحوا على خير.
everyone.
Bye.
مع السلامة. Bye bye.